One of the places that hydration really needs to be taken into consideration is the unfortunate times when patients have to go and undergo a surgical procedure that requires anesthesia. So one of the things, if you've ever had a surgical procedure where they put you under, it's what I call they pipe in the toothpaste. If you've ever seen the medication that we use to anesthetize, it's like really kind of thick and white. So anyways, it looks like toothpaste. Anyway, so when the body is put under for anesthesia purposes to perform surgeries, a lot of the organs and tissues have a dramatic effect put on them, right? And so a lot of things are put to sleep. Most people have been able to experience, unfortunately, the downside of anesthesia, which is your bowels even though you come awake, for the next few days, they're still a little asleep. They're still a little slow and sluggish and things like that. And sometimes we'll actually keep you in the hospital until you're able to give us a movement, okay? Because we want to make sure we don't have that stagnation occur post anesthesia. Well, the thing about that is anesthesia has a significant negative impact on what water does inside of the body because it down-regulates a lot of organ and systems biology. So one of the things that we really want to make sure we do is not overly hydrate. In other words, don't throw in tons of water and fluids in the attempts to kind of get water to work more efficiently and to stay present. One of the things, the downside of anesthesia is your body will also have a lessened or acuity to that thirst sensation for some people. Some people, it's just the opposite, and they're super thirsty, and no matter what they drink, they can't quite feel that they're actually getting that hydrated effect. Well, either way, Oral IV is a fantastic product that I've been using for many years with patients and things like that coming out of post-surgical procedure. Even something so simple as as being sedated when it comes to having a dental procedure, but much less major surgery or replacement of a hip or a shoulder or something like that. But what I just recommend to these patients is that they actually go into the procedure under euhydration, proper hydration, and a supplementation of the first couple of days, 2 or 3 prior to using Oral IV prophylactically. And then when they come out of procedure and they're able to consume fluids and they're cleared for that, to go ahead and start putting Oral IV on board. And generally I will have them dose that TID, or 3 times a day, with their fluids, making sure that they keep into consideration the amount of fluids that they consume should not exceed about 3 liters a day. Unless there's hemorrhaging, loss of blood or something like that, it's a different story. But generally speaking, you have to take into consideration the IV fluids that are actually given during that time, because to deliver drugs, they're going to be pumping in water with a certain amount of saline in there. Pain medications, all kinds of crazy stuff that are necessary to facilitate that medical support. So anyways, moral of the story is, also ask your practitioners and your surgeon and the team to keep track of how many ringers or how many bags, and just ask them how many bags of fluids or saline am I in there, because what we want to make sure we do is not create a hyponatremic state and then start trying to pump in more fluids to feel like you're hydrated, can actually create a very life-threatening kind of a condition. So if you have any type of anesthetic associated procedure, whether it's small or large, you want to start thinking hydration strategy before you go into it, and especially after. Keep track of how much liquids that are being consumed. Try not to exceed 3 liters. Any more than that really is not necessary. Contrary to some popular belief out there, more is not better of the water, especially in a body that does not move the fluids very efficiently because it was all put to sleep for a while, so be mindful of that. Oral IV is a fantastic strategy to have on board when it comes to post-anesthesia because it doesn't have any contraindications, right? So it is a bioelectrically charged, structured water with trace minerals product, a little shot that when you consume it, it imparts that bioelectrical potential to the entire body and helps water and fluid metabolics and dynamics work more efficiently. Okay, so it's a great product to be able to do that. It's one of the things I've used for many years, one of the reasons why I created it. I hope this video makes sense to you and it helps you, get a better strategy going in and out of those oftentimes not so elective procedures. But You can heal, and part of the ways to do that is to maintain proper fluid dynamics in the body, and Oral IV is here to be your wingman for that. So until next time, stay hydrated.